All right. Great. Welcome back. We're here sitting with Monica. Thank you for coming in today, Monica,
Thank
and
you for
World of
having me.
Hurt. And we're looking to help Monica today with some persistent symptoms that you're having in your leg.
Yes.
So, Monica, what we're trying to do today is we're trying to capture information about how the symptoms behave. And so that we can possibly identify what would be the dominating mechanisms that may be involved in the reasons why you're continuing to hurt. So that we can get very specific with the
Right.
exercise program, right? People don't
Right.
have time. So the more specific we can be, the better
better.
recovery is.
Correct.
Right? So I thank you for coming today. This is the first time we're meeting, so I'm going to be asking really specific questions. I know you're working with the physical team, and that's really great. And I know that they have really worked hard to get you to where you are right now. So my job,
Absolutely.
working for them is really just tweaking your program today.
Okay.
All right, so it always is good to get an idea where you're hurting. Like, where is the
Okay.
actual symptoms that you continue to have?
Well, my main pain is on my right foot.
Right foot,
And it's constantly feeling like a crushing pain.
crushing. Okay,
And it's constantly cold
cold.
if I'm not laying up elevated with my leg up.
Okay,
So that coldness also starts to cause like a sore pain, like if I've been hit by a bat or something.
Okay.
Sometimes it turns into that, and then other days where I'm applying heat, I can't apply too much heat because then it starts to feel like I'm being stabbed.
okay. So it
with
can either be
knives.
cold or hot sensitive. Is that what I'm
Right.
hearing? Yeah.
Right.
Okay. And then, like, where is it? Just the foot itself? Like the whole foot, or
Basically, almost the whole foot.
so the top, both sides, and the bottom?
The mostly is all on the right side,
The right outer side.
right
okay.
outer side, and then right below the big toe.
Okay.
And then right where that muscle stretches from the big toe to the heel,
Got it.
and then the heel.
Okay, so the bottom of the foot from the big toe to the heel, and that outer part of the foot.
Correct.
Does it go into the lower leg at all?
Uh,
Above
I,
your ankle bones?
I would say some days that it feels that way, but I'm just not sure if it's because I'm not putting so much weight on it that it's, creating that problem for me, making me think that it's spreading, but maybe it's not spreading. Maybe it's because I'm just not utilizing my leg as much.
I see. Okay, so it's
that make
affected by how much weight you put on it.
Right.
Okay.
Right.
So
So I'm
is
just
it-
still trying to figure that out.
You're still trying to figure it out. All right, that's helpful for me to understand. So you can get this feeling above your ankle bones in your lower leg if you're putting more weight on your lower
Correct.
leg. So, got it. So you don't know if that's really a symptom or is that just my lower leg working?
Yes.
Yeah.
Exactly.
Thank you.
Exactly.
So lower leg versus symptom. I like that.
Absolutely.
And do you get any other symptoms in the thigh or in the hip or in the back on that side? Or is it really just that lower leg and foot?
Well, I do get some lower back pain.
Okay.
I do have some mid back pain and then some shoulder pain.
Okay, so there's other areas
Yeah,
going
neck
on.
pain. But I guess I just haven't been as concerned with those areas as I have as my foot, because my foot, sometimes the pain levels can reach a 10
Okay,
versus
so it can
my
go
back.
that irritable.
Right.
Yeah.
Versus my back, it's, sometimes at a 4, but I can usually manage it with some, Tylenol and laying down and putting some heat on my back.
Got it. Okay, so
So-
you're less in control of the foot
Right.
than you are in those areas, so it makes it more concerning.
Control. Yes.
Yeah, okay.
Exactly.
Tell me a little bit about how that started in the foot. I know there was an actual injury that occurred,
Yes.
I was reading about.
Yes. So I was on my lunch break on my way back to work from my home. I live on a second-story apartment complex, and about midpoint, there's a dented step, and I slipped forward and fell forward, and as I slipped, my foot got stuck in one of the steps,
Ah, okay.
and I jerked, and then when I released my foot, I kept rolling, and then I fell to the
Got it.
bottom.
So there was that foot stuck part, and then there was the actual fall part.
Yes.
Got it. And is that the foot stuck part, is that the part where you feel that the injury happened to the foot?
Yes, I feel like it is because it I was already feeling that pain immediately as soon as my foot was there.
And how was the foot stuck? Do you remember the position it was in?
So there's a stair, so it was in between the steps, and it was like this. So my foot got stuck like this, and as soon as I moved it a little bit, it unhinged, and I kept rolling.
Got it. So it was pointed.
Yes, it was stretched out like
yeah,
this.
it was pointed. Thank you. And how long ago was that now?
This was in July 1st, 2020.
July of 2020.
Yes.
Okay. And I know you've gone through several different treatments since that period
Correct.
of time. Okay. And so I know that it's been there that long. I kind of want to kind of understand how it's been maybe behaving over the more recent months.
Okay.
Right? Because that was the only injury that you've had, right?
Correct. Yes.
Yeah. Okay.
Yes.
And was something broken at the time or anything? Or did they find anything?
No broken bones.
No broken bones. Okay. Thank
No.
you.
They said that it probably would have been better if I would have had a broken bone. At least.
Why do they always say
I don't
that?
know why.
I don't know. I don't know. Why would anybody wish
was like,
a broken
I
bone
don't-
on anybody? But I hear that line all the time.
I
and
don't agree with that line.
Yeah, I'm not sure I agree with it. So thanks for having a common denominator with me. But,
course.
you know, thanks for sharing that with me. I'm not sure breaking a bone would ever be in a favorable situation.
isn't,
Yeah,
honestly.
but I think that being in that position of point while that injury occurred is probably a very relevant thing that we need to look at today.
Right. I agree.
Okay. Tell me a little bit about how it's behaving. So if you rest this foot, don't do anything with it. Does it make your pain better? Does it make your pain worse? Or does it have no effect on the situation at all? Like, does rest change?
Rest actually helps a lot.
How does it help it?
Because if I stay off my foot, it doesn't feel as painful. Say if I'm on my foot, I'm at a 7, 8. If I'm off my foot, not doing much that day, I can usually stay at a 3 or 4.
Okay, so weight.
So it's a lot of
Yeah,
relief.
so the weight bearing actually increases the symptoms.
Yes.
Okay. And so much that it can go to a 7 or an 8.
Correct.
Got it. And you can be off of it and it'll rest at a 3, 4.
Correct.
All right, thank you. That's really helpful. What about moving it? Not weight bearing it, but moving it, pointing it, flexing it. Does moving actually make it feel better, worse, or no effect?
Okay. So I can move it in certain directions. I can move it left, right. I can move it towards me, but pointing it is probably the hardest challenge for me.
Pointing, okay. So actually the position it was in.
Correct.
Yeah. Okay, so pointing is the one makes it worse,
Yes.
right? But the left, right, no effect.
Not too much.
Pulling it up,
Not too much.
no effect. Okay. But not really making it better either.
No.
Yeah. Thank you for clearing that up for me.
Correct.
I have to take a little notes here to remind myself. Is there Monica's test? Like, Annie, every time I do this movement or this activity, I can make it worse. It's kind of my go-to test to tell me that I've either made the
Okay.
condition better or...
Well, I'll tell you about my most recent test
Yeah,
that I've
tell
been
me what-
working on.
yeah, what is it?
So I've been trying to walk without any shoes.
Any
I
shoes,
have
yeah, I know
carpeted
you have-
house,
got
so I try to walk barefooted to my bathroom.
Okay.
And
So barefoot walking.
yeah, barefoot walking. And so I try to even out the weight a little bit more each time. So my distances are not very long. So from the bathroom to the kitchen
Yeah,
and
how
back
far
to
would
my
that
room.
be? Do you know?
I would say it's about 20 feet to
Would
the
we
kitchen.
be able to do that today? Like walk barefoot here and say if we've made something better or worse?
That would be a big challenge for me.
Big challenge. All right, thank you. Is the point the best test we have today in the sense of saying, are we making this thing feel better or feel worse?
I can point it. I mean, I can definitely do that.
Okay.
Yeah.
And you're saying that heat or ice, neither of them actually are very effective for you at this present time.
Right. It's just kind of more like if I'm super cold, I just have to warm up my foot enough just to be room temperature, nothing past that. But even then, it still feels cold on the inside.
Yeah, it feels cold all the time. It sounds like it.
So it's like I can't get past. I can't wear that heat for too long because after that it'll start to feel like I'm being stabbed with a hot knife.
Yeah, no, you have what we call an intolerance to too much cold,
Right.
and an intolerance to too much heat.
Correct.
Yeah. That's an important characteristic to saying, okay, what are we working on at this present time?
Yes.
Okay, so thank you for sharing that.
Mm-hmm.
Are you taking any medications or anything that I should be aware of at this present time?
Yes, I do take some medication.
What medications are you using for pain?
I'm taking the pregabalin,
Pregabalin,
which is
okay.
the Lyrica, and I
Right.
take that. I try to take the lowest dose because I don't really like medication.
Sure,
So we have stayed at 100 milligrams for this past year and a half.
got it. And do you find that the Lyrica is helpful?
Yes, and that's the only reason why I'm taking it, because at night my pain tends to be worse,
Okay.
and so that's when I take my medication.
Got it. So you can be worse more in the night as well.
Correct.
And the Lyrica can, so you take that kind of pre-bed?
Yes.
Yeah. And you're taking 100 milligrams. And how long you been on Lyrica now?
Going on 2 years almost.
2 years, okay. And that's the only med you're currently using?
For pain, I also have the Tramadol, which is an
Tramadol.
opiate, but I don't like to use them, so
What would be an incident where you would use a Tramadol?
where if I do a lot in a day, too much activity, grocery shopping, 2 doctor's appointments, or a family function that I have to go to, then I'm like, okay, I got to take a pain pill because I know I'm going to be
Yeah.
really sore or
So it's activity
cold.
driven.
Right.
So if you have a lot of activity that day, you're going to end the day with the Tramadol.
Correct.
Got it. That seems like you're using them very appropriately, Monica.
Oh, yes. I
Yeah.
just don't like the way the medication makes me feel because I don't like feeling like I'm out of control from my own body.
Yeah, totally. I mean,
So-
I understand what you're saying, and I like, when you've heard when people are on this journey for a long time, and they have actually found medications to actually help them, and they're using them judiciously.
Right.
That's really important. So today's job, though, is about the non-pharmacy, right?
Right.
Yeah, I mean,
Yes.
that's where we are going. But pharmacy can give you a lot of insight to why you're hurting, right?
Correct.
I mean, Lyrica is a great medication because it actually basically dilates the blood vessels to your nerves.
Right.
So your nerves are getting more blood
Mud
flow.
flow. Mm-hmm.
Okay, so to some degree, your nerves are saying, wow, we want to move.
Yes.
We want more blood flow.
Yes.
And that's why they hurt more at night.
Yes, because I'm
they're
not,
not moving.
moving.
Right?
Right.
And so you figured that out. Wow, I can take Lyrica that it will have the same effect as movement on my nervous system, even though I'm not moving.
Exactly.
Yeah. And then you're, using the Tramadol judiciously in the effect that if my activity's been high and the pain is more severe as a result of that, and I need to get myself to go to sleep,
Yes.
I can give myself a break.
Correct.
Right? And I can shut down my thinking
Exactly.
a little bit so that I can sleep. Yeah. So I mean, good job. But that gives us, insight.
Yes,
Gives us insight
definitely.
that we should look at the peripheral nerves. We should understand your central nervous system more. Right?
One other thing that I want to say about the Tramadol, the reason I take it is because the barometric pressure, like when the weather
changes.
is just absolutely
I bet,
one
'cause
of the worst times that I can have.
It doesn't surprise me because the intolerance to cold and heat,
Right.
right? And that's really
Exactly.
what that barometric pressure is the
Yes.
change.
Yes.
Right? So that's good to know that you use it for that circumstance. Have you noticed stress affecting your symptoms in any way?
Well, I'm the type of person that doesn't like to stress, even when
You
I'm.
do like stress? Good. You don't have stress, right? Yeah.
Yeah, I don't like to stress too much unless it's really something that there's no answer or solution to, and there's an answer and solution to everything. So I try to not stress myself out because it will affect me.
Yeah. So you're coping
Yes.
with not letting that happen.
Right.
Yeah. So you've already seen the connection,
I did.
and you've already figured out ways at coping to prevent that from. Yeah. Thank
Yes,
you for
correct.
telling me that. That's helpful. What kind of things do you do to cope? I mean, what's your go-to?
Well, one of the things for coping with pain is just, I guess I keep myself busy. I'm an artist, so I love to paint. I like to do macrame.
Great.
I distract myself with like arts and crafts, basically, or I play Uno with my son, or
So you use your creative side,
right.
your limbic brain,
Or
yeah.
music.
Yeah.
Music. I love my music. Meditation music as well too.
Sure.
That's a big I think that has made a big difference in my progress, because when I find with that when I meditate, my body calms down more and I don't feel as pained as I did before.
Yeah. So how do you understand how that works?
I understand that through my brain. I
Yeah.
feel like my brain controls what my body does.
Yeah,
So if I can control my brain, then I can control my body and what it's doing.
Yeah, I love how you're representing that. You've figured out how to keep the nervous system out of chaos
Yes.
and into calm.
Yes.
And you've actually guided that calmness through the brain, which is really the housing of the nervous system,
Yes.
right? Yeah.
You got to get to the root of the problem.
Yeah, no, I really like what you're saying, Monica. And a lot of that for me is, okay, hey, she's grounded there. Don't spend a lot of time there, right? Spend a
Right.
lot of time on the areas that she may be not doing so well in.
Right.
All right. So over the last maybe 8 weeks or so, would you say this condition as it stands is improving, getting better, getting worse, or it's really unchanged? It just remains unchanged.
I can definitely say there has been improvements.
Okay. What kind of things are improving?
From the first day that it happened, I could not even be touched on my foot.
Okay.
I couldn't bear a sock. I couldn't bear a shoe.
Okay.
And so today I'm wearing an actual shoe with
Yeah.
a foam insert. I can wear my socks.
So it's definitely less sensitive.
Less sensitive,
to
correct.
touch. Okay.
Yes, because I have tried to become obsessed with my foot, as you would call it, and I try to touch it all the time when I'm at home,
Good
trying
job.
to rub like feathers on it, just
Good
like,
job.
trying to desensitize
Yeah.
that
Okay,
feeling.
so you're working on that.
Oh, yes.
Physically. All right.
Oh, yes.
So that's one of the interventions you work on. Any other interventions you're doing that you feel are helping you?
I'm doing my exercises.
What kind of things are you doing there? What kind of exercises?
I do some wall push-ups. I do some just with the heel toe raise.
Yeah, okay. So
Yeah.
standing?
Standing and
One
sitting.
leg, two
Yes.
legs?
One leg, just this leg.
Just
I'm
the right leg.
Just
so
my
you're
right leg.
standing only on the right leg and doing
Oh, no. I'm sorry. I'm standing on both legs.
both legs.
Yes,
Okay.
both legs, but I'm just moving my right
Yeah,
leg.
you're
Yes.
getting your up and down. So you're doing calf raises.
Yes.
Got it. Any other things that you're doing?
Right now, I'm also doing it's like I grab the towel and I just try to pull my foot forward towards me.
Okay. Are you sitting, standing?
Sitting.
Sitting.
Yes,
Okay.
I'm sitting.
So
I'm
you're just basically
pulling.
trying to stretch your ankle upward.
Right, because I had that frozen foot.
Yeah, that's what
So-
I heard about that.
Yes.
Yeah.
So I'm trying to work through what I can for now.
All right, so we're using that strap to stretch the ankle joint.
Correct.
Yeah, any other things that I
Um,
should know about? These are the current ones I'm taking, right?
Yes. Let me see. I can't think of any more right now.
Okay, that's good. If something pops up, will you just let me
Yeah,
know? I just
yeah,
like to know a
definitely.
little bit about what you're doing, and that you feel like these things are having a bettering to the condition at this point.
Right. And I think it's just mostly, honestly, my exercises every day. But I think I'm constantly doing exercises because
Yeah,
I'm that.
you're either touching it or
Yeah,
you're
I'm-
moving it or you're putting
Right.
weight on it.
Exactly.
Am I
So throughout
following
the
you?
day, even if I'm just in the kitchen cooking a small meal, I'll sit on the chair and I'll move my foot around, So I'm constantly just trying
Yeah, I like that.
to move it all the time because I feel like if I don't do it, I'm going to stay stagnant.
All right, these are the hard questions,
Mm-hmm.
right? Because this is really kind of the heart to the matter, like what people think about the condition, what they believe is still happening, and the reasons why they still have pain.
Okay.
Can you give me a little bit? I mean, why do you think this thing still hurts 18 or so months later? I mean, you're too smart not to ask that question. So,
Right. Thank you. I never even heard of this before my injury. I never even knew it existed. So when I got it, it was just kind of like I was very confused myself. Like, what is going on? Like, I'm telling my brain to heal my body, and it's not doing it. It's like not working. What's going on? So when I figured out that I couldn't control that, I guess that's when I decided to go, the medical route and try to find out if there's something going on the inside,
Totally, yeah.
because like I just was, I honestly can't really say what causes it to stay. Like, I think it's just, what I tell my friends is
Yeah, what do you tell your friends?
my foot is stuck in a trauma state.
Okay, I like this. Keep talking.
So say, for instance, like when a soldier, he goes to war, he gets traumatized. Sometimes they come back, they're a little traumatized, they're stuck in that. Something triggers them, and it's automatic, behavior set off or anything like that. So basically, that's how I look at my foot, is that it went through a trauma and it just stayed stuck in that trauma, and it's not healing itself.
Yeah, and how do we get it out of that trauma state? I mean, I like where you're saying. I mean, this is how you've explained it.
Right.
Is that I can still hurt 2 years later because my foot is stuck in trauma.
Yes.
My brain thinks my foot is still in trauma.
Yes, that's what I tell them.
Yeah.
is it's still stuck in trauma. So,
So what's the answer of getting out of stuck in trauma?
I think working, just trying every opportunity that I have, or option that I have, because one of them has to work one of these days.
Sure.
So I know that that's what I want to keep doing. Just
Sure.
keep finding, keep looking what's going to help me.
Yeah, I like how you reference it. I do. And I think we need to test some things today that either validate that, right? Because you are doing the work to your foot.
Yes.
Yeah. But sometimes we got to do the work to the brain.
Correct.
Yeah. Because there's a little foot in your brain.
Yes.
Are you
there
aware
is.
of that?
I like the way you put that. Yes.
There's a little hand in your brain.
And it's working my foot.
Well, not necessarily, but your brain has representation of every body part you have.
Oh, yes. Yes, I know what you mean now.
Yeah.
Okay.
Tell me what I mean.
All the nerves are connected to the rest of the body, so every nerve functions with the pain or the comfort that we're feeling, right?
You are definitely on one track. I'm on another.
Oh, okay.
Yeah, and I like what you're saying. And if I give you a little visual of it, okay? Because I really want to test this today.
Okay.
I think this is an area that I think we need to rule out or rule in, right? As a means of, can you be hurting because of this mechanism? And so just to kind of give you a precursor is sometimes, right? I mean, if you think about it, we have a brain, right? And in our brain, there's actually a representation of every body part. So within our brain, there's a hand, a left and a right hand. Within our brain, there's a left and a right elbow. There's a left and a right shoulder. There's a left and a right hip. There's a left and a right knee. There's a left and a right foot. There's actually representation of our sex organs.
Oh.
And it's a really cool mechanism. And sometimes when our brain goes through significant trauma, okay, it basically starts to re-image or reorganize that representation of that body part as broken. And it gets stuck in that.
Right.
It's exactly what you're
Yes.
talking about. Now, in order to help, because when the brain re-images the body part relative to the trauma, and it gets stuck in the trauma, okay, even though it wasn't broken, it shuts it down.
Right. Doesn't want to heal it.
It actually loses the representation.
Okay.
It's a cloudy image. It's almost forgotten it.
I see.
Yeah. And that's why when that forgotten process starts, because the brain is protecting that foot because it still thinks it's in trauma. And it's re-imaged it as broken, and it's now forgetting it. You hear all kinds of things. You hear that it can't tolerate cold, it can't tolerate heat, it can't tolerate touch, it can't tolerate being weight-bearing. Sometimes the skin could look even different. The hair on the leg can look different. So the key, because it's now shutting down the foot, Because when that process starts happening, it shuts itself down.
Right.
So you have people working on the foot, but if you can't get the brain to recognize the foot,
You can't do anything else with it.
yeah, you have to literally re-image the brain to the body part.
So how do we do that?
Ooh, we're like on. We do that by testing this thing called left-right discrimination and how quickly and accurately you can discern images of feet, left and right. Because we can actually test how well does your brain, Monica, recognize your hands? How well does your brain recognize your shoulder? How well does your brain recognize your neck and your back and your knees? And if we can test those different areas and establish what is Monica's normal, we can go and test the feet. And we can see if the brain recognizes the left foot different than it recognizes the right.
Oh, I see.
Yeah.
Okay.
And if we're seeing, well, that brain is less accurate and slower for the right foot than it is for the left. And if we see it's less accurate and slower in the right foot than it is to other body parts, then the mechanism
We shut down.
to why we're hurting is the recognition of the body part. And I'm not going to stop you for what you're doing on the foot. But if we don't get the brain to recognize the foot,
It's almost pointless to be working on the foot.
it
if you
takes a
don't work
heck of
here.
a long time.
Yeah.
It takes a heck of a long time.
Okay.
Okay, people kind of get stuck.
Right. I can see that.
And they get it, they understand it, they're coping, they're trying, they're doing everything right, but they're not rehabilitating the image that the brain carries about the foot.
Okay.
Okay.
So in order to do that, how do you?
We test, literally, we use a different, an app called left-right discrimination.
Oh, yes.
Have you done
I'm
this?
aware of that.
Yeah. Have you used it?
I have.
Do you have it?
I can't remember if I have it still, but I think I'm Amy had told me about it, so I
Yeah.
haven't gotten to it yet, but
Well, here's what I'd like to do today, okay? You've given me great understanding,
yes.
okay? And I've given you a little understanding, okay? That lines up very much with what you're thinking and your belief. My brain got stuck, okay? And I need to test this today. So as I set up like your exam, right, I'm kind of saying to myself, well, she's giving me things that says maybe it is this brain forgetting the body part. So you better test that today, Annie. Maybe it is the motor autonomic mechanism. And she's not doing enough for the brain. She's doing all the work on the foot right now, but she's
Right.
not doing the work on the brain.
Right.
Okay? You can't get a brain better by treating the foot.
Yeah.
Just like you can't get a foot better by treating the brain.
Right.
Okay, it really is. You've also given me thoughts today that I should look at your nerve, the nerve that literally goes to your foot.
Okay.
All right, so based on your history and how you presented the data and the presentation of the problem, I want to go, wow, is it the brain's representation of the body part that we're actually still dealing with? Or is it the nerve that actually goes to the body part that in some way needs to be
Okay.
intervened with?
Right. Okay.
Because you're working on the foot. You're working on where it hurts.
Right.
But I'm talking about why it hurts. Is it the nerve? Is it tight? Is it not getting enough blood flow? Or is it the image of the body part?
So figuring it out with the left-right app.
Helps me
Helps you.
discern this.
Okay.
And doing some neurogenic tests helps me discern this.
That makes sense.
Okay? And I can't argue with what you're already doing with the foot. Right? I'm not going to take away nor add. But I also want to complement that.
Right.
Okay? Because I'm questioning, wow, is something going on here at the nerve? or is something going on with the representation of the foot in the brain? Okay, and that's not an uncommon situation that happens when trauma happens.
I didn't understand that before.
Yeah.
Thank you for explaining that to me.
Well, tell me how you've taken that in, because I know you have heard a little bit about it.
I have
you know,
heard a little bit
and
about it.
you're familiar with the app that I'm talking about.
Right,
Yeah.
right. And I kind of have an idea of it. It's just, I guess it's more of trying to stay on it because I'm constantly thinking about my foot, that it is hard to kind of, think about my brain and how it's going to change things in my foot. You know what I mean?
Right. And yeah, so here's what I'm hearing you say is, I'm not quite sure I completely understand how the brain literally reorganizes that image.
Yes.
Yeah. And that's actually cool. We have, our brain is full of little neurons, okay? And it's how we learn how to move, okay? And when there has been trauma and the brain pretty much redirects those neurons,
Okay.
okay? They can just remember the trauma and be trauma neurons, and they remain in trauma.
In trauma, right.
Yeah. So just like you make this muscle stronger because you give it exercises to make it stronger, you have to challenge your representation of that body part by looking at body parts and saying, is it left? Is it right? Is it left? And the quicker your brain recognizes those body parts, it basically reorganizes those neurons to represent that body part more.
I want to try that.
Yeah.
I want to do
And it's
it.
a cool process. And I think that, what a freedom this is when we actually can say, I didn't realize we can actually change the neurons within the brain to re-represent the body part.
Okay.
Yeah.
Right.
And sometimes we have people do things we just don't understand why we're doing them. Right?
Yes.
Yeah.
Correct.
But let's do that first.
I
Let's
agree.
do that first.
I agree.
Yeah. Well, this is you've seen this recognized program before?
Yes.
You have? Okay.
Well, I haven't done it all the way, but
Yeah, and we're just basically talking about the science of it right now, right? So we're going to use an approach called graded motor imagery, right? It's a form of brain training. So we're directing it right at the brain. It's aimed at reducing pain and improving performance. That's what we're trying to do, right? Okay, and it can assist with your rehab of range of motion and obviously complex injury states that have occurred. So we're using a certain approach.
Right.
Now we're going to do what's called left-right discrimination, right? So the ability to quickly and accurately recognize an image of the body as either left or right. Okay,
Right.
and we can see the quicker people can recognize and the more symmetrical they're recognizing, we can actually establish the norm for that person.
okay.
Okay, so that's what we're doing. That's the science behind it. Okay, and what, are you doing all right?
Yes.
Okay, so we're going to do a thing called left-right discrimination, right? We're just going to do a basic test today, okay, just so we can look at it. So this is what you and I are going to be doing, okay, more you than me, right? So it's going to show you pictures, right? And you're going to tell me, is that foot left or right,
Okay.
right? Just as a practice run. Just so you get your kind of feet wet, as they say, huh?
Yes.
Yeah. Good. So it's a practice run, right?
Mm-hmm.
You actually did really well, right? Now,
Yes.
this is a very basic program. So be it that you're a little higher performer prior to your accident, I would need to test you at a different level to understand a difference.
Okay.
Okay, but I wanted to get you orientated
Kinda
to what
warmed
you're
up.
going to do,
Okay.
right? It's a little warm up, right? So we're going to go back to the menu. All right, are you having pain in your foot at this present time?
Yes.
All right, how bad would it be if you gave me a number?
Right now, I'm
Yeah.
at a 6.
A
And
6.
it's mostly cold.
All right, 6, and we're going to call it cold. We're just tracking it, okay? So this time when you hit it, now you're going to see different pictures and different orientations of feet. You're going to do the same thing. Is it a left foot or is it a right foot? The goal is to be accurate,
Okay.
okay? So don't guess. Be
Okay.
accurate, all right? As soon as you hit go, good, nice job.
Thank you.
I'm going to write some things down, right, so Annie can remember. That was your first trial. We're going to take a couple of them, right? You can see how nice you did here, right?
Yes, 100.
You got them both right. And 1.5 seconds, 1.7 seconds, not too bad, right? Okay, I can't really make an argument there.
No.
All right. Let's test it a little higher, right? All right, so now you're going to see pictures of feet in context. So you might see the foot on a bike wheel,
Okay.
right? So you're still, same goal is it a left foot or is it a right foot? Okay?
Okay.
Still at a 6/10 cold?
Yes.
Or would you say it's any different?
It's still 6.
Got it. You ready?
Yes.
All right, as soon as you're ready, hit go. Oh, what the heck happened?
The sticks are right
Yeah. How do we get it out of there for you? There we go. Hit go and you're hit go.
there. All right. Hmm.
Little different, huh?
Yeah, a little bit.
Look at you, girl, you're rocking it. Doesn't matter how hard I make the test.
I like a challenge.
Yeah, I like people who like challenges. Would you say your pain feels any different after doing this set? Or the coldness?
The coldness is always getting a little bit worse by the minute, but
Okay.
the pain is still probably at a 6
Got it.
for now.
So now we're saying not cold, we're also saying pain. Is that right? Do you find that interesting?
I'm not too sure because, sitting for
Wouldn't
some-
matter, yeah.
yeah.
Normally that would bother you. Can I do one other body part?
Yes.
Yeah, I want to test a different body part outside of your feet and see if you have a different rating,
Okay.
right? Because I'm going to say that's pretty impressive, don't you think so? Yeah,
would
I do
say so.
too, yeah. Remember, I'm trying to rule in or rule out. All right, so now I'm going to do your hands. It's still a left-right game, okay?
Okay.
All right, so now you're going to say, is it your right hand or is it your left hand?
Okay.
Okay? All right, when you hit go, it goes.
All right. Here we go. Oh, man.
Oh man, hands are always different.
Yeah, that's.
I'm going to give you a couple trials, so.
Oh, my God. This is definitely more of a challenge.
Not too bad, though. I mean, look, you're still really symmetrical, right? I mean, I can't say that these are that far off,
Oh, man.
okay?
Okay.
But
So
I want to be honest with you. Your brain's recognizing your feet.
that's a good thing.
It's a great thing, better than your hands.
Maybe because I've been working on my foot so much.
Working on your foot so much, but also you pay attention to it a lot.
Yes.
Yeah.
I'm obsessed with it,
Yeah.
as I would say.
Well, it's a good obsession.
Yeah, it's a
Let's
good
agree,
obsession.
right?
It's-
Because
yeah.
it's all about recovery.
Right.
Okay? But as I'm running this test, right, remember why I was here. I wanted to rule out, right? I wanted to rule out this mechanism. In the motor autonomic mechanism, the brain is forgetting the body. Okay? In this mechanism, the area of the brain that represents the body is in a state of dysfunction. Symptoms are related to the misrepresentation or lack of recognition occurring in the brain. Right? Re-imaging the body image and disfigurement by using imagery or sensory, what you're doing in motor exercises, right?
Yes.
Is how you get it back. Now, I'm testing you, looking for something and realizing, wow, her brain's recognizing her feet better
More
than
than
her hands. She's symmetrical in her hands and she's symmetrical in her feet. So in all honesty, even though you have symptoms that would make us think that this is going on, you're in a good place of recovery relative to that. So whatever work you might have done there, you may have already reestablished that.
So that's the progress that I've been
It's the
working on.
progress probably you're talking about. Now, I got another way I want to look at this.
Okay.
Okay, I want to look at imagery. Now, imagery is a little different.
Okay.
Okay,
Another challenge.
it's a little bit of a challenge, but it's really it's a very subjective challenge. Okay.
Okay.
I want to go to a place where I give you a picture, okay? All right, of your left foot. All right, there's your left foot in a pointed position.
Mm-hmm.
You see it, right?
Right.
Okay, you can see how that left foot is pointed, right? All right, so now I want you to close your eyes for me. Okay, and I want you to picture in your mind your left foot in the pointed position. You saw how the ankle was pointed, it was pointed inward, toes were pointed, okay? And in your mind there, you're getting a very clear picture of your left foot.
Mm-hmm.
Do you have a clear picture of your left foot?
Yes.
All right. 10 is, Annie, it is very clear. 0 is, I could not see it at all. And 5 is, I'm unsure. Where would you rate the clarity of that left foot image that
I
you
would
had?
say a 7.
7. Okay. All right. So now we want to take that same picture, right, of the right foot now.
Mm-hmm.
In that pointed position. Right? That right foot in that pointed position. Okay? Close your eyes. Okay? I really want to see that right foot in that point, that turned in, toes pointed. I want you to work on seeing how clear that picture is.
That one's a little more difficult.
Yeah, well, if we use the same scale, 10 is very clear, 0 is can't see it at all. Annie, 5 is I'm unsure. Where would you rate the right foot?
I can see myself, but it's kind of like my brain doesn't allow it to go past just seeing the foot, but not moving.
Well, where would you
So-
put it on a clarity scale of how well you can see it?
I
If
would say
7
like
was
a
left,
2 or 3.
2 or 3?
Mm-hmm.
All right. Now, when we talk about this motor autonomic mechanism, right, the first stage of recovery is they can recognize left versus right. You already got that. Look at your 1.5, 1.7, 1.8, in the hardest ones. Okay, so your brain's doing really well in left-right discrimination. That's step one. Nice job. Step two for a brain to recover is that it can get an image. It can get a clear image.
Okay.
Okay, imagery, right? You've heard about imagery.
Right. So that would
Okay.
be an exercise that I can
We
work
have to
on.
work on. Yeah, I mean, think about it. Look at, we got a right-sided image in the brain. We got clarity of a 7.
And then versus the 2 or 3.
Yeah. Or the left side is 7, and the right, we're sitting here at a 2-3.
Right.
So
That makes sense.
you have conquered step 1, but you're still showing us problems within creating the image. So that's why you can still give me symptoms of that mechanism, is we're not progressing that program to imagery.
Okay.
Now, how you can do that, like, you know you're going to touch your foot. You're doing all this work to your foot. Before you do the calf raises, before you do the strap stretch, before you touch, I want you to take 30 seconds and go, I want to see my hands touching that foot. See my foot doing those calf raises. Train the image of
Okay.
that foot.
Yes.
Yeah, because we're not clear,
Right.
okay? And so that mechanism can still be a viable mechanism when we haven't gotten to the point, right, of clearing.
The image.
Yeah,
Right.
me giving you this app and doing left, right isn't going to help you.
I have to do it on my own.
Well, you're already good.
Yeah.
You're already good at that step. It's this imagery step that we've got to work on. And you can easily do that, Monica, already in your existing program by right before you do your program, image the program. Image the foot doing the exercise.
Okay.
Okay? And work on trying to get that 2-3 to that 7 where you can really see it clear.
Okay.
Okay? Because the brain's recognizing with good accuracy and good speed, but it's having a hard time creating the image. And that image is going to help with your performance.
That makes a lot of sense.
Yeah, tell me what you've
I didn't
heard
know.
so far.
I didn't
Yeah.
know how it actually worked before to actually work your brain. So I didn't know that just imagining would be an exercise.
Yeah.
So I never took it as like it's important.
Yeah. Well, it's
It's-
important to progress this program.
And in order to progress, I need to take those steps.
You do.
And I now I understand it a lot more better because before I was just like, okay, I know I have to meditate. I know I have to tell myself to heal.
No, meditate. No, wait, hold on a second. Meditation is calming the nervous system.
Right.
Okay. This is not meditate. Meditation is not imagery for performance. They're different. Imagery to help performance is literally seeing
The actual foot.
the actual foot doing it.
Okay.
That's a different part of the brain than me meditating to keep me calm.
Right. I felt like I was stagnant in the meditation part.
Yeah.
Because I felt like I was constantly working on it, but I wasn't seeing no improvements.
Yeah, well, I think you've mastered meditation for pain control, but we're not mastering image for foot performance.
Right.
Right? So when you say, Annie, I got to do that barefoot walk to the bathroom, I'm going, Monica, before you even take off, I want you to see that right foot walking barefoot to the bathroom. I want you to see every step it's going to take before you actually do it.
Okay.
I want you to prime the brain's image of that performance before you take the brain and the foot into the performance.
So I'm training my brain.
You're training your brain, but you're not training it left-right. It's already learned that. But it's not
It's training it to
imaging
see
the
it.
performance. Yeah.
Yeah.
Okay, and this is where a lot of people stagnate in recovery of that mechanism because they don't work the imagery.
I could see why. It's kind of complicated to understand sometimes when you don't have somebody kind of you like explaining it, it kind of
Think
helps
about your
to hear about
greatest
it.
athletes. Your greatest athletes, I don't care who they are, they do imagery work. Michael Jordan, he saw 1,800 images a day of the best defenders to beat him to the basket. Mia Hamm, she did over 1,200 images a day of her shooting that foot and that ball in different parts of the net. Those two athletes spent more time training their brain imagining than they actually did training their body. And that's what differentiated them from good to great. Right. So you're using a center of the brain that's been well proven in performance, but you're got to progress.
Right.
You got to progress to the imagery part.
Yes.
And it doesn't take much in your already existing program to do it. You just got to spend 30 seconds, right? Like if I have you do your calf raises,
Right.
can you try your calf raises with me today?
Yeah.
Yeah?
I usually have like a pillow or
Or
a
how about
towel or
even
something.
sitting? You want to come around on the front for me?
Yeah.
Let's just do one set like you're going to do it at home.
Or standing, you mean?
Either way, you
Okay,
use a
'cause I
wall though,
usually-
don't we?
To do the
Yeah, the standing.
Yeah, okay. Yeah, I use the wall.
Do you
usually,
use
but
your
I can
shoes?
turn my body this way.
Yeah. Well,
Well,
how about I raise this up? All right, now
Right there's good.
before you do anything, you're going to take a moment right now.
oh,
You're going to close those eyes, okay? And I want you to see your right foot. Close your eyes. And I want you to see your right foot go up on the toes, back to the heel. I want you to see every repetition you're going to do. Slow it down. See that right foot go up on the toes, back down to the heel. Work on seeing how clear that can look. Seeing every little piece, the whole foot point, it's up on the toes, it's pointed, to the foot is bending and coming back down to the heel. And when you tell me you got a good, clear picture of it, now I want you to drive that picture into an action,
okay.
okay?
All right. I'm a little scared.
Yeah, how can I help you here?
No, that's okay. I'll hold on to this.
Yeah,
Okay.
just going up.
just gotta
Use
bear
the
weight.
image. Use the image that you saw. You saw it already do it. I want you to see it again. See the image. Feel the foot. That's what you're doing. See the image. Feel the foot. Good. That was a good one. Let's try it again.
Okay.
Yeah. See the image. Feel the foot. Good, and down. Now I know it's painful. I can see it on the face.
I don't mean to make the faces.
No, it's good that otherwise how would I know,
Yeah,
right? Unless you're
right.
telling me, okay? But what are you feeling in the pain?
I'm not, I guess the soreness, like
Is it the coldness
like-
that you're feeling?
yeah, the soreness and then like the coldness and then I guess I would call it the tightness.
The tightness.
Yeah.
All right, how many more reps do you need to do in order for you to tell me it's either the same, it's better, or it's worse by doing the imagery?
Probably maybe 3 sets.
3 sets of,
Of,
have you done 3 so far?
let me see, I could challenge myself so I could do 5.
All right,
maybe.
5 reps.
5 reps.
Okay. Every time I want you to see it in your head. I don't want any other things in that head other than a right foot. Okay? And I want you to focus on the image. Focus on the image. 2 more good ones. Focus on the image. The clearer you see the image, the more the foot functions. All right, nice job. Take a seat.
Okay.
All right, tell me what you've experienced there by working the imagery. You've been doing that exercise forever, correct?
Yeah.
Yeah.
Sometimes,
Anything
little-
different about doing the imagery with the exercise?
yeah, I could definitely say that it made a difference, like in the pain managing. I guess I'm not so focused on the pain.
Okay, you
I'm
took
focused on my
from the
foot.
pain to the thing.
Yeah, I'm focusing to the movement of my foot. So
Okay, I
it
like
kind of
that. Any other thing?
distracted me in
Yep,
a way.
I like that, and I want to explain that. Any other things?
Um,
Did you notice anything in the 5 by working the imagery?
did I notice anything in the five?
Anything in the 5 reps?
Oh, I think the pain might have been a little bit less than when I usually do them at home, not imagining it.
Fair enough. At least we know we didn't make it worse,
Yeah.
right?
Well, the way I see it is, if, pain doesn't always equal harm.
It doesn't, and we're already concurred on that, right? We already
Right.
know we're doing no harm.
Right.
Okay? Here's what I noticed. As you kept doing it, and I kept trying to say, Monica, focus on the image, the foot bending. I saw your foot go up and actually roll out and come back down.
Oh, wow.
I saw a much more symmetrical up and out on both of those feet, especially the last 3 reps.
Okay.
I also saw your face change within the reps, right? Less of a face, okay?
I was trying to focus on my breathing.
Well, I think 2 things what I wanted to pick up on is you're right. When you got out of the pain part of the brain and into the image part of the brain, it changed,
Right.
okay? And it also aided the performance of the ankle. Things got much more natural and smooth in your rolling out, especially at the top. You actually went all the way up on those toes.
Yes.
Okay, so my observation was something changed in pain and something changed in performance by introducing the image.
Correct.
Okay, so we're going to take right now that little data point that we sniffed out is relevant. We need to get it into your program, and it's called imagery. And you can already do it within your existing program. You just got to get your brain to focus on the image of that foot and what you're doing.
Yes.
Whether you're touching it, whether you're walking, whether you're going up on those toes. So it's not that difficult. It's just being present.
Right. And that's not something that we do every day, is imagine our body parts. So it's
No, but let's agree yours is not clear on the right foot
Yeah.
compared to the left, right?
Right,
We're sitting
right.
here at a
Training
7 on the left and a 2-3 on the right.
right. Right. That's interesting to know.
Well, and we also tested, let's be honest, I went right at and tested in the pointed position, the injured position.
Oh,
I did your imagery work in the position,
if my injury.
yeah.
Yeah. And
And why did I do
You
that,
just-
Monica?
then you just had me stand, so that's how my foot went.
Yeah.
Oh my God.
But why did I do that? Come on, go.
To trick the brain into
To bring
thinking
it,
that
keep going, you're on
it's
it.
gonna do the same thing as what I was seeing on the app.
That, as well as, that's the place it's stuck.
In here.
Yeah, it's stuck.
I'd never connected those 2 things together.
Yeah, so we got to really work on that image of where you were in trauma,
Yeah.
because it's kind of not allowing it to have its image. You can't walk. You're not going to do that. Every step. Every step.
Right. That is interesting.
That's how powerful that is.
It is.
Okay. Yeah.
Now that I know, I'm gonna work on it more.
I know. I think today I'm kind of in this place where, gosh, you don't have to tweak Monica too much. But you do have to tweak that is still relevant, okay?
Yes.
That she doesn't have to do left-right discrimination, but she's got to work imagery. And she's got to work imagery going into point, because that's where she has this, I'm stuck,
Yes.
okay? We're never going to unstuck it.
I want to do that.
Yeah, all right, so
wanna do
tell me what you're hearing from today's visit as we are debriefing this.
Basically, you're just telling me that we have to work at training the brain so that we can, whatever we see in our brain can actually be reality with our bodies.
Yeah.
So with training my brain to do that with my foot, it's going to help it progress.
It will. Yeah, nice job. You hit it on the head. I mean, if we can't create the image in your brain,
Can't make it happen.
can't make it happen.
I agree.
Yeah.
I completely agree.
And I think you still have that image that it's stuck in that traumatic place.
Yes. I
When
think
you
so.
already inherently know it's not,
Right.
the image is stuck in that place.
Yes, and that explains why when I see other people using their right foot and they're doing something strenuous to it, I'm stuck in that trauma state. So I'm thinking, ouch, they're going to hurt themselves or so forth. I am, and I can admit that I've been stuck in that trauma state.
And it's okay, you know, and one of the hardest parts of recovery, and I know you know this, so bear with me on it, is you have to move from faith to faith to faith to faith.
Absolutely.
Okay. Now, here's what happens with a lot of good people. They go from faith to doubt to unbelief, back to faith. To doubt to unbelief, back to faith. To doubt to unbelief. And every time that person moves from doubt to unbelief,
Setback.
setback.
And you're square one again.
They're back in the healthcare system, seeking something. Something's got to be wrong. Somebody's got to have figured out something by now.
Stress.
But I want you to understand what's happening is you're not moving from faith to faith to faith to faith to faith. Okay? So today you know that the function of your foot is important.
Right.
You know that it's healed. You know that the brain is stuck in a trauma state. But the brain's lost its image of the foot performing.
It really has.
It really has. And if we don't work on the image and the imagery and putting it back in that position and showing it over and over and over again that it can do it, and it can do it on a barefoot floor, it can do it in socks, it can do it in whatever it wants to,
Right.
we can't remodel.
And that's something that actually that I have done before where I've kind of tried to imagine myself, say I took my niece swimming or something and she's running across by the pool or something, her feet are slamming, I'm stuck in that trauma state. So I kind of like try to imagine myself and I set myself back because I stop myself from thinking about it because it starts creating pain in my foot because I'm giving myself that thought. So then I just leave it alone. I just drop the thought. So that makes a lot more sense to keep imagining it. I have to get through that
You do.
tough part
You do.
to get where I need to be.
You do.
Right.
And
I see
that's,
that.
yeah, and it's the hardest part to recovery
I see that.
of that mechanism. And most people, that's what happens, is they don't do the imagery work. And that's why they get stuck. So you're not stuck in trauma, you're stuck in recovery because you're not doing the imagery work. So I want you to I'm not stuck in trauma, I'm stuck in recovery. I have not trained the brain image of the performance of my foot.
Okay. I like that.
Yeah, so we're stuck in recovery
Stuck in recovery.
because we have not trained the brain's image of the performance of the foot.
Right.
Yeah.
Right. I really like that.
All
Thank
right.
you for that.
Well,
I appreciate it.
this was a very fruitful session.
Yes, absolutely.
Yeah. And I want to thank you very much because not only I know which is helpful for you, I know it's helpful for the therapist that's working with you at Physical. It's going to be hugely helpful, Monica, to other therapists and to other people that are in the same place.
Good. I'm
Yeah,
glad to
so
hear that.
I really appreciate you doing this with us today, and
I
I
appreciate
look
being
forward
here.
to hearing
Yeah.
how well you're doing.
Yes, you will see me dancing again.
Oh, I can't wait. Are you going to say goodbye to your friend over there?
Oh, bye, Amy.
Bye, Amy. Yeah.
Hold on. Is Lindsay going to say it's a wrap? Because I already feel like
It's a wrap.
Okay.
W-O-H. We're out of here.